Hello everyone, thank you so much for joining this Instagram Live. Bear with me while I join our three fantastic speakers.
Hello everyone,
Hello, hi
can you
Charlotte.
hear me
Yes, we can
well?
hear you well.
Amazing,
And
hello.
just adding in Katijana and then Sarah will be joining too. Hi Katijana.
Hello, everyone.
Hello. So we just have one more speaker who will be joining, Sarah. One second. Hi everyone. Thank you so much for joining. And I think we have our final speaker who has joined us. Hi, Sarah. How are you?
Hi.
Good. Thank you
Good.
so
And
much for
you?
joining. And we can all hear each other well, right? Perfect. I can hear you guys also. So I think we should start this really exciting discussion. I'm going to just spend a couple of minutes briefly introducing kind of who we are as Mental Health Europe, what this Instagram Live is all about, and then I will be passing over to you to introduce yourselves. I want to say a quick thank you to everyone who has joined so far. We really appreciate it, and happy European Mental Health Week. So for those who aren't familiar with who we are, my name is Fatima. I'm Policy and Knowledge Officer at Mental Health Europe, and at MHE we are the largest independent European organization working on mental health, and we believe that there is no health without mental health. And here we really recognize that mental health is a part of everyone's life, and we advocate for those who experience mental health problems. And this conversation today, we really set it up because it's the fourth edition of European Mental Health Week, which is taking place from the 22nd of May till the 28th. So today is actually the first official day. And the theme that we have for this year's European Mental Health Week is mentally healthy communities. And this is kind of a broad term, but we're focusing on a number of different areas. So we're looking at mental health at home or in private life, mental health in education, which our Instagram Live today is focusing on, mental health at work, in the workplace, and also broader communities. And as part of the week, we've set up several different conversations on various social media platforms to really dive in a bit more into detail in these topics and to find out more information and have kind of conversations with experts on these areas. So I will highly encourage everyone who has joined that may not be aware of these events, these conversations that are taking place on Instagram, Twitter, and LinkedIn to check out our website, which includes a calendar with all the events we have planned for the week. And so I think I've kind of given a brief overview as to what the theme is and what we're focusing on today. And I would like to then, without further ado, pass over to our three fantastic speakers who have joined us. That are experts on the area of mental health and education, which we'll be focusing on today. We're joined by Katijana, who is the Vice President of Education for the European Pharmaceutical Students Association, and her colleague Charlotte, who's also a Policy Coordinator at EPSA, and will soon be taking on the role within her mandate as Vice President of European Affairs. And finally, we're joined by another colleague from the Sirius Network, Sarah, who will really be bringing in the perspective focusing on migrant education. So I think you're better better place to introduce yourself. So in a couple of sentences, it would be great if you can each go around and let viewers know who you are and what you focus on specifically. And maybe if we could start with you, Charlotte, as you're the first person I see.
Of course. So hello everyone, it's very an honor to be here today to speak on behalf of EPSA. So my name is Charlotte, I'm a fifth year pharmacy student from France, and I'm currently the policy coordinator for this mandate. And for the next mandate, I'll be the vice president of European Affairs. So basically, my role, just in a nutshell, is to represent 100,000 students from pharmacy from all over Europe to advocate for their positions and for their needs.
Thank you so much, Charlotte. Maybe Katijana, if you follow on.
Yes, of course. Welcome, everyone. First of all, thank you very much for this kind invitation. It's a great pleasure to be here and share our experience and what we are doing as EPSA. So my name is Katarzyna. I'm the current EPSA Vice President of Education. So basically, I'm in charge of all educational activities within EPSA, as well as I'm helping with assessing the needs of students in terms of their pharmaceutical curricula and inclusion of mental health in the pharmaceutical curricula.
Thanks so much. And Sarah, if I pass over to you.
Yeah, so hi everyone. Again, thank you so much for inviting me. I'm really happy to be here in this super interesting conversation. So I am Sarah, and I work for Sirius, which is the European Policy Network on Migrant Education. And at Sirius, we promote the implementation of inclusive educational policies for migrants and refugees across Europe. And in my role, I support projects on socio-educational inclusion of migrant and refugees. And one of them is actually focused on the well-being of migrant children and young migrants who suffer from trauma disorders.
Fantastic. Thanks so much for the introductions. And I just want to quickly say, for those who have joined, thank you so much. We will have a short Q&A towards the end, so please do include any questions that you have in the chat, in the comments below, and we will be sure to cover it before the end. So thank you for the introductions, and actually, Sarah, it would be great to follow on with you, especially as project and policy officer. We know that schools, universities, and learning environments really provide an opportunity to reach larger numbers of children, adolescents, young people, but also wider audiences as well from different backgrounds. But unfortunately, not everyone necessarily has access to mental health support or to even have access to mental health promotion and prevention programs. So it would be good if you can maybe start off by kind of giving us some information on what is the connection between education and mental health?
Mm-hmm. Yeah, so well, thank you for the question. So, I mean, I think education and mental health are actually really connected, and that the connection, it can be seen at different levels, because if, for example, we look from a more general perspective, research shows that a lack of education, and specifically a lack of education in mental health, can increase mental health issues. Because of course it's really important to talk about mental health, and it's especially important to talk about mental health in schools to try to create awareness on what it is mental health, why it's important mental health, and why it's important to look for support in case you feel you need it. And also by talking about mental health in schools, we kind of eliminate all the stigma around mental health and all these taboos that are around mental health. And I think it's really important actually to talk about this in schools and in education, since it's a really important part of our society, I think. Then as well, the lack of education in many cases leads to less qualified jobs, and these less qualified jobs come with a lower socio-economical situation or a more uncertain situation that in many cases also provoke distress and can cause anxiety and depression. And again, this lack of education, it kind of impact on mental health of people because of the socioeconomical status that they have and all the distress that it causes this situation, no? And if we focus more in traditional school and traditional educational settings, let's say, of course, mental health is also essential because without mental health and without the good psychosocial well-being of students, they cannot perform properly in schools, and they cannot succeed in their education. So it's really important that they have the psychosocial well-being to actually have a good performance in school. And the students' well-being can be affected by many factors. It can be, as I said before, by socioeconomical factors or a difficult family situation. But also, for example, it can be provoked by something that is happening in the school, actually. For example, bullying, that is something that unfortunately we see a lot now. But also for the nature of my work, I think about discrimination, exclusion, like that is something that unfortunately migrants and refugees face a lot, these type of things. And this, of course, it affects to their well-being and to their mental health. And actually, since COVID, we see that more than 20% of students, young students and children, suffer from mental health issues. So this is actually really important. It's not a minor problem right now. So it's important that schools and our teachers are well prepared to support them. And actually talking about teachers, teachers are really important, of course, because they need to be well aware and informed and to have the knowledge to implement good protocols in schools to support the mental health of students. But also it's important that we support the mental health of teachers because they cannot put this in practice if they don't feel support and if they are not in the good state of psychosocial well-being and mental health that they need to have to perform.
Absolutely, yeah. Thank you so much. I mean, you covered kind of the importance of when we talk about education in a school setting. It is pivotal for an individual in terms of providing mental health protective factors or risk factors. That in education, it's an opportunity for people to learn about mental health and to, understand stigma or destigmatize mental health, and also for the support for the supporters as well, the role that teachers play in educating students about mental health, but also being in a position to take care of their mental health and be supported. And one of the themes of one of the pillars of our theme this year, which is focusing on mentally healthy communities, is mental health in the workplace. So I think some of the points you raised is definitely very, very relevant for that as well. So thank you for that. I'm just going to jump into the next question, which is kind of talking a bit more about investment in mental health. Why should investing in mental health literacy and including mental health in the school curricula be the first step towards ensuring adequate prevention of mental health problems, as well as the risk of reduction of stigma, and how can this facilitate people's access to support? You touched on it a bit in your intervention, but it'd be great if you can expand on it.
Yeah, so as I already said, I think schools are key in the promotion of mental health and the well-being of children and young people. Because at the end of the day, they spend a lot of time in school during really crucial years of their life. So for that reason, it's really important that they start to develop these competencies while they are in school, right? And also because all what they develop during these years is actually really important skills that it will go with them through all their lives and that they could cultivate in the following years. So for that reason, it's really important to include it in the curriculum because it's a really sensitive time in personal and individual development. So therefore it's important to, of course, create that tools in the schools and to make them available by, of course, having a specialist in mental health that can support the students and also, as we say, the staff working in the school, but not just limit the mental health to this more specialized support, but also like across all the areas, including all areas of the curriculum, meaning that teachers need to be trained as well, not just trained, but also support to effectively implement these practices, like not just to have the knowledge, but also to have the capacity to actually implement it and to create more safe spaces where students feel they can talk about mental health without being stigmatized and ask questions and ask for help if they feel they need. And of course that safe spaces are free of bullying or of any type of discrimination who might affect to the mental health of the children in the classroom.
Absolutely, yeah. There's, schools are almost like a second home aside from the home itself. That's where they spend most of their hours, so it's a very important and pivotal part of the young person's life. And education can also be a wide range of things, from formal to informal education as well. So I think you really provide some really important points there. And in terms of including it in the curricula, that really then connects it to addressing the challenge at a structural level rather than looking at an individual, placing the responsibility, for example, on teachers. We have to look at kind of a wider lens of what we can do structurally to improve the reality of mental health in education and mainstreaming mental health within the curricula as well. So thank you for that. And I just want to ask one last question, specifically because you focus on migrant and refugee education. What is the impact of education and schools on the emotional well-being of migrants and refugee students? And what can be done to ensure a safe space, as you mentioned earlier, where everyone can thrive, particularly looking at a more structural perspective as well, kind of what can be done at that level?
Mm-hmm. Yeah, so if we focus in migrant and refugee, I think it's a kind of, they have a more particular background, let's say, because of course, to move from one country to another, like that experience can be really challenging. And some of them, they even come from context of conflict, war, persecution. So of course that it affects to people's well-being, to individuals' well-being. But I will say especially to children and young people, because it's a really crucial time. But even though you don't come from a conflict situation, just the fact of moving to another country is difficult, and to create again this sense of belonging, it requires of time, and it requires of a lot of strength, I would say, and all that process, it can be really challenging for them, and it can affect to their mental health. And on top of that, after all the process of moving to another country, and maybe that you have been in another situation that it was really difficult and even dangerous, when you arrive here to Europe, you have to face an economical difficult situation, or even the feeling of exclusion and discrimination because of your origin, because of many things. And actually, this is something that migrant and refugees face every day in Europe. So this it really affects to their well-being at the end of the day. And for that reason, school, it becomes really, really, really important, because it should be this space of protections where they can foster inclusion in the new home country. And therefore, it's important that schools cultivate an environment where mental health is at the base, of course, but that intercultural awareness and inclusion are always the goal, because I think it applies for every person, for every student, but especially with migrant students and refugee students, there is no mental health if there is not this cultural competencies and this willingness to include them and to accept them as they are and to appreciate that cultural differences, no? So for that reason, I think it's important not just to cultivate or to train mental health competencies, but also intercultural competencies and a good understanding of their backgrounds and their situations. But then, of course, we have maybe more severe cases of migrant and refugees who might suffer from trauma, because as we say, like, some of them, they come from really difficult situations. And actually now in Sirius, we are working in this project that is called Enable, which focuses on helping building the self-confidence and emotional skills of children who might suffer from trauma. And to do so, we aim to enhance the capacity of primary schools and secondary schools to deal with these cases of psychosocial trauma by developing tools and first-level treatment mechanisms that can support schools. So for example, this one, it could be one of the changes that can be applied in school, like to create the protocols and to create the training for teachers so they can implement all these strategies. And in the project, what we are doing is to creating this training, and we'll have a pack of protocols that could be applied, not just in the school we are working now, but that could be adapted to other contexts. That is the goal after all. And we will also have an overall strategy where we will find to create regional policies, or at least to influence regional policies to promote these policies on psychosocial treatment for migrants and refugee children who suffer from psychological disorders.
Thank you. Thank you so much for sharing insight on that. And I'm sure viewers can find more information on your website regarding those projects and for young people that experience mental health problems. So I will move on now. Before I ask the next question to our colleagues from the European Pharmaceutical Students Association, someone included a question as to whether this live will be recorded. It will be saved on our page afterwards, so you will be able to look back on it and also share the live. So just to answer that question. So I think now it would be great to hear a bit more about kind of mental health of students from your experience at EPSA. In general, it's well understood that there's an urgent need to address underinvestment in mental health and mental health education. And it would be great to kind of understand a bit more to improve the mental health of students. We need to better understand what their needs are. And how at EPSA do you integrate mental health as a priority in your strategy? And what impacts does that have on your members? Because you work with quite a lot of students across Europe. So I'll pass it over to you.
Okay, thank you so much for the question. I hope you can hear me well. Okay, so I will give you a small insight on our past survey that we conducted about mental health on 2021. So we saw that the majority of students, so 98%, experienced stress during their pharmaceutical curricula, and this was done because of the exams, too much pressure from the professors, but also hectic schedules. And we know that stress has multiple consequences, whether on physical health, but also on mental health. And for this, we analyzed, and we, with the survey, we saw that 50% of students experience mental ill health, and of these 50%, there were 60% that got the mental health because of their pharmaceutical degree, which is actually quite a lot. As future healthcare professionals, we have a double role in the mental health aspect because we are students experiencing stress in our studies, and also because of the COVID-19 pandemics, we had struggled a lot with this issue, but we are also future healthcare workforce. And so for this reason, we also want to address this issue of mental health. So EPSA, what are our mission? What is our strategy regarding this? mental health is a huge priority for us, and we tackle it in multiple aspects. So I will be covering more the advocacy aspect since I'm the current policy coordinator, and then I will pass the floor to Kasia to speak about the educational aspects. So we have several positions on the matter, taking into account our 41 members' perspective that are coming for 35 different European countries. And for this, we also collaborate a lot with various stakeholders, with European institutions, and we also recently answered to a public consultation on comprehensive approach to mental health. In addition, of course, we represent EPSA in various events, online or live, and we approach the topic of mental health in many manners. Kasia, if you want to add something.
First of all, thank you for the question. To add to what Charlotte said, basically, with the survey, the outcomes showed that there is a big issue when it comes to mental health, and students really need this support. So what we are doing as EPSA, we are assessing the needs, what is lacking, so that then we can take further steps and advocate for respective changes in the pharmaceutical curricula. And Charlotte already mentioned how we are doing this. When it comes to education, we are organizing a lot of initiatives for students, such as public health campaigns. Last year we had Mental Health Month. So this is like a long initiative where we give students tips, and we try to also stress the importance of mental health. We also have organized trainings, workshops, and symposia, mostly live during our live events. And basically, with all these activities, we not only try to educate students about mental health, but also provide them with knowledge and tools so that they are able to assess what is lacking in their pharmaceutical curricula, what can be further improved. So like in the end, they can also advocate so that we all can join forces and improve the state of our pharmaceutical curricula, and we can have more mental health. We can basically learn more about mental health during our studies.
Thank you so much for both providing that unique perspective. I think you've definitely highlighted the role of future healthcare professionals and the importance of getting it right while they're still students, so that we can better support them, find out their needs, and also ensure that mental health is adequately integrated into the education process. So thank you for answering that question. I'd like to now follow up by asking whether you can share how education and mental health can actually support future healthcare professionals and how EPSA is contributing to this. You mentioned your strategy and kind of how you're reaching out to your members. It would be great if you can expand on this.
Great, so maybe I will go first now. So I would like to stress that mental health is a vital part of our training as future pharmacists, and this is as important as physical health. And with the right education, with the right preparation, we can improve the patient care, so we can care for patients more effectively. We can recognize mental illnesses in a better way. We can also better educate about psychiatric drugs to improve adherence. And last but not least, we can better promote mental health habits. So this is very important. There are so many areas where we can help our members, help pharmaceutical students around Europe to be better prepared in the future. And we are doing this mostly through our activities and projects. Some of them I already mentioned: workshops, trainings, symposia. We give them specific tips so that they are able to better handle their own mental issues, but also they are able to better help their colleagues, their friends. And Sarah before mentioned that this supportive environment is very, very important. So we are also trying to show our members that we can do it ourselves. At our universities, we can build this supportive environment. So I think it is very, very important as well.
Yes, definitely. If I can just add on it, also regarding the mental health issues, it is important to educate members on the facilities that they can also find in the universities, so they know where students can go to actually prevent the issues being developed. And Kasia already mentioned that soft skills are also very beneficial in order to manage others, but also to manage ourselves, to keep the to prevent the burnout, to learn how to say no to things, because sometimes students are accumulating a lot of stress because they cannot say no, and all of those things they should be taught to students in order to make them prioritize their own mental health. And yeah, this is the main topics that we want to stress out.
Thanks so much for sharing. I think you've highlighted also kind of the importance of taking the right approach, and I just wanted to briefly mention also the importance of pharmaceutical students and also other healthcare professionals and students as well, in terms of understanding mental health from a human rights perspective as well. At Mental Health Europe, one of the things that we really push for is a psychosocial approach to mental health, which is in line with the UN Convention on the Rights of Persons with Disabilities. So really looking at mental health as a human experience and ensuring that this social determinants are addressed at the core to ensure that an individual received tailored and the correct support. And I think definitely in terms of ensuring education around mental health is very, very important, but also ensuring that it's a correct kind of right approach in which future healthcare professionals are also trained is also necessary. So I thought I'd quickly mention that. But I want to ask you both a final question before I then start to check for any questions in the chat box. Could you both briefly share the role and power of students and the power that they have in changing the system? I mean, again, we mentioned kind of the challenges often being at a structural level, which trickles down. The empowerment of students is so important. Yeah, it'd be great if you can touch on their power and also kind of what you push for also at EPSA in regards to this.
Yes, for sure. So many actions can be done at a local, at a national, and also at the international level, as we are currently doing with EPSA. And we actually see a lot of inspirational action that are being taken by our students, which is great. But all of the changes that need to happen at the national level, they are like really focused on the national level. And so for this reason, in EPSA, we strive to help students to set up some initiatives like this and to fuel their development, because some actions are really restricted to the local and national. And for example, to illustrate my statement, I know that in Portugal, for instance, they have been working a lot about this matter, about mental health. They have been advocating a lot, and for this reason, they now have also access to free psychologist sessions.
Excellent.
So as you can see, yeah, you can see there is an input from their side, so they were strong advocates, and there is also success. It's not only unidirectional, it's not only students advocating and no response. And I think we should keep looking for this hope to have some responses also from the higher authorities and from stakeholders in order to improve our systems.
Thank you, Charlotte. Katarzyna, I don't know if you want to add on?
Yes. So maybe I will add on to what Charlotte said and mentioned, that when it comes to changes at our universities, there are still some gaps in the curricula, and some things can be definitely improved, including we as EPSA, we have a lot of members. We can, for example, investigate teaching methods, because in the paper we released, it is mentioned that teaching methods, some specific teaching methods can put more pressure on students. So it would be also very important to decrease this and try to, for example, have a different method so that students are less stressed and they can just feel more at ease when it comes to specific subjects, and they don't feel this huge pressure, especially when it comes to exam periods. We've all been there, so we know that it can be a little bit tricky. As well, when it comes to more education part, we can promote mental health initiatives, so that we as EPSA, we can organize them, but also, as Charlotte mentioned before, we have our members in different countries, so we can also inspire them, and they can organize different public health initiatives at local level, and they can raise awareness about mental health. So this is also very important. And last but not least, we as EPSA, we can share different initiatives and projects, both governmental and non-governmental, with our members, so they can learn from different sources, from different places, and they can basically grow and try to improve their knowledge about mental health.
Great, thank you so much for answering all those questions. I don't see any more questions in the chat. If you do have any, please send across. We might be able to cover one. But in the meantime, I just want to highlight that, as we all know, in the last few years, it's been very difficult for there's been a strain on people's mental health across the board. And this year's theme for European Mental Health Week is mentally healthy communities. So we're focusing on understanding and learning about mental health in our communities, schools, workplaces, and at home as well, so that everyone can thrive. And I just want to ask you all a quick question in a sentence. Could you tell us why weeks like European Mental Health Week are important? Maybe if we can start off with Sarah, if you don't mind, and then we can go around.
Yeah, sure. So I think it's just important to bring some light on this topic and to create a conversation around it. And I think it's important to talk about it and to create a more, as we're saying, supportive community, because mental health is not just about the individual, but it's really about the community. And without a supportive community, I think there is no individual.
Absolutely. I'm just going to put a pause, because I know I asked you all this question. I see a question in the chat. I'll read it out, and if any of you want to answer, please jump in. So the question is, how can we as educators or teachers spot when a student's mental health is low, and how to start the conversation? Is it better to talk to the entire class, or take the student, talk to the student separately?
Honestly, if I can start, I think it really depends actually on the students, of course, and also of the environment of the class. In that regard, I would say that it is very much individual, and that the assessment should be done prior, because of course every person is different, and in that manner you have to adapt to the person, and also to see what they need the most in order to really have an actual outcome on the interaction that you will have with them.
Thanks, Charlotte. Anyone else want to add on? No pressure. I wanted to quickly mention that also starting the conversation around mental health early on so that it's normalized is quite important, and also setting up frameworks to support a student if they're going through something, so that they know who they can approach, and the system in place so that there's that strong support system integrated into the school or whatever the setting may be. Thank you so much for that question. And I interrupted another question, which was around kind of the importance of awareness raising weeks. Katijana or Charlotte, I don't know if you want to follow on from Sarah's great answer earlier.
So maybe I will go now. So I think it is very important, because this way we can show the importance of mental health. And for example, when it comes to pharmacy students, the results were very shocking for us. That there are like the statistics show that still so many things can be still improved. And for example, students don't know where they can get help at the university. So definitely raising awareness about the importance of mental health. Also sharing good practices, because different associations provide different opportunities, create different projects, so we can get inspired and we can share our good practices. We can also discuss what can be improved. Here I'm referring specifically to the pharmaceutical curricula and what can be changed in order to improve the current state. And last but not least, we can provide students with different tools and also motivate them to act at local level, because as mentioned in the beginning, if we join forces, we can really improve.
Thank you.
Yeah, definitely. And just to add on this, I think as future healthcare professional, we prefer to prevent before healing. And in that manner, I think that this kind of advocacy and raising awareness actions are very beneficial, because it can give people the tool to actually investigate on maybe an arising issue that is actually coming, but that is not developed yet, and it can prevent the issue to be developed a lot. And for that reason, I think that these actions are so beneficial for students, but also for the entire society, because mental health is not only restricted to specific communities, it is tackling everyone. And for that reason, everyone should be concerned.
Thank you so much. Indeed, it's important to prevent mental health problems and also support those who are already experiencing mental health problems as well as recognizing mental health as a topic that impacts everyone, whilst ensuring tailored support for specific communities based on their needs as well. So, I mean, thank you for this really fruitful discussion. I mean, it's fantastic to have EPSA here on the call with us, and also the Sirius Network, to really provide those different perspectives. And it's important to also provide an intersectional lens in all the conversations that we have as well. So thanks a million. I think we will stop the conversation here for today. I recognize that we did focus a bit more on schools and education, whereas education can concern many different areas, including, for example, NEET groups, those that are not in educational training. And it's really a wide topic that we can discuss for hours and hours on end. But I hope you enjoyed this Instagram Live. Please check out the Mental Health Europe website for European Mental Health Week to see what else we have planned, and also other projects that we do, including the latest one, which is called Ahead Bet, which indeed does focus on vocational education training, which is another topic as well. And keep in touch with us by following our social media websites and also the EPSA page as well as Sirius as well. And I'd like to end by thanking you for joining and for your questions. And if there is a topic that you would like us to cover, please let us know by commenting on this video once we upload onto our pages as well. So thank you very much and have a lovely rest of the day.
Thank you very much.
Thank
Thank you for joining. Thanks.
Bye.
Bye-bye.
Bye.